Our first speaker is Professor Samuel Mwalili. He's a professor of statistics at Jomo Kenyatta University and director of the Center for Health Analysis and Modeling at Strathmore University. He specializes in mathematical modeling of infectious diseases, and he's led national projects including the Kenya AIDS Indicator Survey and Kenya Population HIV Impact Assessment. He's provided technical support for Kenya's National AIDS Control Council and served on the National COVID-19 Modeling Technical Committee, contributing to public health policy and HIV prevention. Welcome.
Thank you so much. Yeah, ATMAC is a collaborative work between our universities, that is Jomo Kenyatta, Strathmore, and also we also work with the NYU team. And of course, also we also got support a lot from IDM when it comes to modeling. And today, I'm going to present about funeral practices. Oh, thank you so much. And today, I'm going to present about funeral practices. Number one, see how they elevate the HIV risk. And two, look at how interventions actually do improve or reduce HIV incidence. That's interventions on funeral practices, which could be biomedical, like PrEP, could also be behavioral, like condom use, or maybe structural, things like empowerment of women. And this is actually the western part of Kenya, or Nyasa region. So I think we all know that HIV epidemic is concentrated in Africa, actually more particularly sub-Saharan Africa. I think about 9 million people in sub-Saharan Africa are living with HIV, and that's where the epidemic is. I just to draw you back to Kenya. Much of our epidemic in Kenya is concentrated on western part, and I think the team from Kenya, which we have presented before, have shown that much of it is concentrated in Nyanza. And of course, the US government, like CDC, USAID, and other development partners have spent billions of dollars in Nyanza. And I think the $1 million question, the epidemic actually has not gone down in terms of incidence in Nyanza. Of course, no prevalence has remained constant or high because of good treatment. So that's why we are focusing on Nyanza and why we are picking actually funeral practices as one of key drivers of epidemic in Nyanza. So, what is in Discomatanga, or what we call funeral practices? Because these are cultural practices. And this happens when someone dies, relatives and neighbors will go to the compound or to the place in the name of trying to help the person who is deceased, or the family which is deceased, which is a good thing. And this is a common practice in Nyanza, western region of Kenya, and also in coastal part of Kenya. But now the sad news is young girls, young boys, and also other men take advantage of these funeral practices to leave their home and engage in risky behaviors. So I think that's the main challenge. Okay, yeah, that's what basically happens. And I'll look at some of the risk behaviors, just in brief, and then let us show you how to model that using a mathematical model. Oh, yeah. So these are some of the examples of risk behaviors. For example, there is sex in exchange for money, where these young men, actually even older men, do give money to young girls during those funeral practices. And I'm going to show you later that actually this practice usually does not take just one day. It can take 1 week, 2 weeks. Some people are just dancing, celebrating, but the process, there's those who are taking advantage of the scenario. Also, there's also the aspect of multiple partnership, where men who are married leave their families and also engage in risk sex behavior during those funeral practices. Those are very common things that happen in those communities. And also there's also aspect of drunk alcohol use. At the same time, people take cat or marijuana and other kind of drugs, excessive drinks during the practice. And I think this is because of the stage settings, because sometimes this happens at night. Sometimes the wood, you know. And then, of course, as I said, this may take like between even like 1 week, and usually it happens from 10 p.m. Social activities that happens at night. So other kind of risk behaviors, as I said, we also have transactional sex. That is where men pay girls, and also usually the key major driver actually is also the where these discomatangas are situated, because sometimes it can be happen anywhere in the locality. Those are some of the risky behaviors, and you can read the paper by Joel and others, which are actually have lighted more on discomatanga, basically the funeral and dance practices. So that's the background of what we want to look at. So what we did basically was to model this using eMod, and of course with support from IDM, people like Clark, Dalby, Captain, who have actually supported us in this activity. And what we did, we took advantage of a model that exists for Nyanza. Actually, we have a fully calibrated model for Nyanza that from eMod that exists. So we did not start from zero. We had a model that was existing. So what we did basically was to create like a migration category or group within the eMod, so that when an event happens, when someone dies, because that's what we trigger the activity, because someone has to die for there to be a funeral practice, because there can't be funeral without death. So because someone has to die, and so what we did was to create a node which will respond to death in our community. Maybe to demonstrate this, you look at the diagram, and we have a big node, which is central node, which the individuals in the population, or people at risk in the population. So when someone dies, you can see the yellow node. When someone dies, then you get into the yellow nodes, meaning individuals go to the other nodes, which are the discomatangas now, where these funeral practices are happening. So that's the way the programming is done. So when there is a death in the population, this will trigger individuals to move or to migrate to these nodes, which are yellow. Maybe the nodes which are green, those are places in the community where already there's no death, so there's no discomatanga. Sometimes, actually, even within a distance of 10 kilometers, you can even have as many as 10 funerals, 3 funerals happening at the same time. So that can happen at the same time. So I think I'm trying to explain now what's happening. So once the funeral concluded, individuals in the yellow nodes go back to the big circle. So they go back to what we call the central node, because there's no more funeral practice. And now it goes back and forth like that. So what we did actually, we modeled several scenarios. Number one, to look at the time between 1980, when the epidemic began, HIV started, to 2024 now, and also project what will happen in the future. And in the future is when now we put the interventions from 2025 to 2050. And these are biomedical, like HIV PrEP. Then also bring behavioral, like reduction in condomless sex, or maybe increase in condom use. And we also have structural interventions such as empowerment of women in those communities, because much of it is controlled by women. So those are the kind of interventions that we put into place. And this is actually what we found, both for male and female. We don't see a much difference between male and female. So the blue line is before adding discomatanga, and then broken line is discomatanga, meaning when the practices are happening. And what we see clearly at the beginning, from 1980 to 2024, because this practice has been there, we see a separation of the line, meaning there's a significant difference in terms of HIV incidence But we see as we put interventions, as time goes, as we put interventions, the two lines kind of come together, meaning this intervention may work over time, hopefully 2050, or beyond 2050, if these practices can stop, or these interventions do work. And of course, I think somebody said, of course, there's been even a legislation in Kenya try to ban disco matanga, but because the cultural practices and it happens deep in the village, it still does continue, despite the efforts that have been put by the government. So we see summary, we see the intervention are working, but of course it may take longer than even 2050 to achieve what we want to achieve. Then we also do maybe disaggregate now the same results by intervention, whether it's behavioral, biomedical, or maybe structural. What we see basically, because we have the biomedical, we have the maybe high biomedical intervention, medium, and low. The same also for behavioral. What we see actually biomedical intervention, the lines which are more either just oranges. When you look at it, we see actually there's some more gain with the biomedical interventions, then the behavioral interventions. We also see some gain in structural interventions, but there's not much difference between structural interventions and behavioral intervention. But there's much gain when we do medical intervention. But of course, we know some of medical interventions like PrEP are very expensive, though highly effective. I think also show the same information in form of like a box plot, where again we see the impact of these interventions. Now, this is now due the time 2025 to 2050. So look at the cumulative infections and also the cumulative deaths. So you see the death averted below, and up there we see reduction in infections, and we see clearly actually with the high coverage of our medical, we have high reduction in terms of new infections. Of course, you also see the same for behavioral, and also some little impact, about less than 2% due to the structural interventions. And we also see the number of deaths averted also do follow the same pattern. We see the death averted due to biomedical is quite high compared to behavioral and also structural. So basically what we see, the intervention do work, whether the magnitude may not be that big, like 100%, I see like 3%, 10%, but this intervention do work. And remember, HIV is not about one thing, it's about many things. So if we do control, practices, we do control other things, then we believe we can achieve a lot by combination efforts towards reduction of new infections and also reduction in death. I think I'll skip this because it's always the same information, and a lot of people don't like numbers. Because such a much of this information, whatever you saw here, was derived from those numbers. So in conclusion, we claim this work maybe be the first of this kind, modeling disco matanga. Of course, we know there are papers people have written about disco matanga, like Joe and others, but we have never seen a mathematical model for disco matanga, and we have done this using EMOD. And also we see there is a potential for those intervention strategies, that's both behavioral, structural, and also biomedical, in terms of reducing HIV transmission and also reduce the death rate in Nyanza region. But of course, we don't think we have done enough. We still believe there's much more that can be done in this area. So we still believe we do understand more about these practices in Junior, because I think we saw there was also the issue of the web inheritance and other factors. But for now, we're only focusing on what do you call it, disco matanga, open oral practices. So thank you so much, and I do appreciate IDM folks, like I think Dan B. Clark, my colleague there, Dan Kioi, David, I don't know David is here. Yeah, David's the back there, and many more, Daniel and others, who we have worked together. Actually, it has taken a lot of work and time to do this. So thank you so much. And over to you, Chair.
Thank you so much. We have time for 2 questions. Anybody would like to ask? This one here.
I'm not.
Thanks. Hi, great talk. Thank you very much. That was very interesting. And sorry if I missed it. I just wanted to hear about the assumptions that go into the structural changes, the female empowerment. What was the assumed effect size there, or what was that achieving? And then did you do any sensitivity analyses around that to see how much, if it could achieve more, if you changed your assumptions a little bit? Thanks.
Yeah, thank you so much. And I think that's the time. I think now we are doing more of sensitivity analysis just to see, even expand our scenarios. And I think some of the empowerment of women could be like education, because we have to educate women in the rural areas on maybe the way to engage, and also take care of their children, especially do the funeral practices. Because you see, as I said, once we have these practices, usually children, the young girls mainly, leave their home and try to attend those practices. So we have to do a lot of civic education among women and also the young population. But I agree, there's a lot need to be done. And I think now the next phase is to do more sensitivity analysis on the model. Yeah, thank you.
Thank you so much. Is there one more question, maybe? If not, let's thank the speaker one more time.